Today I'll be talking about the basics of anesthesia. The word anesthesia actually comes from Greek origin, and it means the loss of sensation. Anesthesia has been around ever since the first surgery has. Some of the early drugs that were used for anesthesia were opium, marijuana, alcohol, and belladonna. Come the 1840s, opium and alcohol were the main drugs that were used for anesthesia, but they were still not very effective compared to what we know today. In 1846, a dentist named Dr. William Morton used a sponge soaked with ether to remove a tumor from the jaw of one of his patients. Although many doctors were skeptical of his use of the drug, the patient claimed that they had no memory of the surgery, and that's pretty much all it took to convince other doctors of the use of this drug. After the publication of Dr. William Morton's discovery, another doctor by the name of Crawford Long came out and claimed that he had first used the drug back in 1841. There was such a dispute about who used it first that Long even tried to take it to Congress to gain recognition for it. In 1845, Dr. Horace Wells was endorsed by the American Medical Association and the American Dental Association to use nitrous oxide to pull teeth, which was very successful and is still used today. Today, anesthesia is given either through an IV or through gas. Oftentimes, doctors will use a combo of both, sometimes starting out with an IV and then later on giving you more gas to prolong the effects of that IV. The gas is usually a combo between isophane or desulfane with nitrous oxide mixed in. The IV injection they give you can be anything from ketamine, sedatives like Valium, and depressants like sodium pentothal might be in the IV. No one is exactly sure how anesthesia works because no one is quite sure how consciousness works, but we do know some things. We know that it affects the spinal cord, which is what causes the muscle paralysis and makes you immobile during the surgery. The brainstem is also affected. They believe that this is what causes the unconsciousness of the patient, and it also affects the cerebral cortex, although we're not exactly sure how that is affected. Anesthesia can usually last anywhere between 1 to 6 hours, depending on the surgery that they're doing. The more extensive the surgery, the longer you'll be under, and the worse recovery you'll have. The 4 stages of anesthesia that a patient will go through. The first stage is called induction, where the patient will get their injection or gas, and the patient might start feeling the effects of those drugs. The second stage is called the excitement stage. It is a very, very short stage, but it starts right after the patient falls asleep, and in this stage they will have twitching, they'll have a regular heartbeat and irregular breathing. Once again, the stage is super short, and the patient will soon move on to the third stage, which is called the anesthesed stage, where the patient has full muscle relaxation and paralysis. Even the eyes and eyelids of a patient can't move, so they tape down your eyes so that you're not just staring at them the whole surgery. The heartbeat and the breathing of the patient will become normal and regular again. The fourth stage is actually called the overdose stage, which is very, very rare and usually doesn't happen, but if it's not treated right away, it can cause death, brain damage, the heart may stop, and breathing may stop. After surgery has finished, the patient will be taken to what's called a PACU unit, which stands for the Post-Anesthetic Care Unit. In this unit, they will probably give you an IV of warm fluids to counteract the dehydration and extreme temperature changes that you'll be suffering. Patients usually wake up in about an hour, but it can take longer for some people. After, you will probably feel nauseous, you'll probably vomit, and you'll probably be super disorientated. So it's always a good idea to have someone there with you. Before you go into your surgery, you'll meet with your doctors, and it's very important to give full disclosure on any meds that you're on, as they might make you at higher risk for a complication. They will also tell you not to eat the day of your surgery. This is important because during surgery, you might run into something that's called aspirate, where you actually inhale the food that was in your stomach. One scary fact I learned is that about 2 out of every 1,000 people suffer from a condition called anesthesia awareness. This is where you are totally paralyzed, but you can feel something. So some people report just not being able to breathe. Some people report feeling pressure. Some people even report being able to feel the actual surgery, but they can't do anything about it because they're totally immobile. Once again, this is every 2 out of every 1,000, so it is pretty rare, but it does have extremes on both ends of it. So while there are some very scary things that are involved in anesthesia, especially since no one really knows how it works, it always is extremely beneficial to modern day medicine, because I know I wouldn't want to go in a surgery and not have anesthesia. Some of the sites that I got my information from were the Medline Plus. It's a service of the U.S. National Library of Medicine, the Web Medical Dictionary, Wikipedia, and HowStuffWorks.com. Thank you.